At 5 o'clock, we told you about the second American patient diagnosed with Ebola who has arrived for treatment here in this country now. The woman's husband says she is weak, but he's optimistic that she can get through this. And last night at 6, 10, and 11, we told you about another person who went to a New York City hospital with signs of Ebola, possible. That person recently visited Africa. And now many people are asking if an outbreak could happen here in this country, and are we prepared for it? Our News 4 medical expert, Dr. Peter Ostro, is here with more on that. Doctor?
Everyone's afraid of Ebola, but there are other things we should be much more afraid of. And the answers to those two questions are no, an outbreak isn't going to happen here, and yes, we're prepared for it. Emory University Hospital in Atlanta is equipped to take care of patients who have or who might have Ebola infections. So is Mount Sinai Hospital in New York, and so are hospitals in Buffalo. The Centers for Disease Control and Prevention has put out detailed recommendations for spaces and equipment in order to prevent the spread of this infection.
In private rooms that have their own bathrooms and have limited access with all staff members using appropriate personal protective equipment.
Dr. Selleck is in charge of infection control for the Western New York VA, the Kaleida System, and UB Medical School. He points out that a private room at the end of a hallway with the door closed and careful monitoring of people who enter is quite adequate. You don't need a special isolation unit.
No special air handling is required by this since it's not spread by the airborne route.
It's very unlikely that we would have a case, but he and his colleagues are prepared.
Discussions have been, what would we do if the case shows up, realizing that a case probably is not going to show up. Most people who come back from Africa with fever do not have Ebola. They're much more likely to have other things.
Ebola is frightening, but we're more frightened than we should be.
We tend to worry about exotic things like this, but there are things every day that are killing us. Automobile accidents, smoking, influenza, things like that.
The chances are that very few Americans will ever be exposed to Ebola, but beginning in a couple of months, we'll have another flu season. And that's guaranteed to kill 30 or 40,000 Americans. And we can prevent that simply by getting a flu shot. That's what we should be worried about.
We're big on flu shots here, that's right. Now, I want to ask you about airplane flights. I feel like every time I take a long airplane flight, I catch something, some kind of a virus. So if we're talking about Ebola on an airplane, I mean, what about that?
You might not catch those things on the plane. You might catch them at your destination, okay?
I think it's the plane.
Ebola is scary. It has a high mortality rate. There's no specific treatment so far that's been approved for it, okay? So sure, it's scary, but in order to catch it, you have to have direct contact with the blood or body fluid of a sick patient. And you're very unlikely to get that on a plane. You won't get it from the air, breathing the same air on the plane.
Right on you on the plane, right? Beware of that. All right.